Today, I'm remediating Week 2 General Survey, Measurements, and Neurovitals Practice OSCE. The student reports observations from their general survey, including at least one comment related to each of the 4 categories. The 4 categories in general survey are physical appearance, body structure, mobility, and behavior. Starting off physical appearance, I will be reviewing age, sex, level of consciousness, skin color, and facial features. And for age, the student will ask the patient to identify their age, and they will compare that to the age they may look like. So, for example, a patient may identify their age to be 40, and they might not look 40 due to drug use and abuse. Moving on to sex, sexual development appropriate for gender and age versus delayed, so when they hit puberty. Level of consciousness, whether the patient is alert, responds to spoken voice, and is attentive and oriented. Like, for example, is the patient responding to just general questions? So what their first name, last name, like where they are, if you ask them where they are, the time, the date, the season, and their situation, or rather their chief complaint. Moving on to skin color, even skin tone, pigmentation varying with genetic background, and intact skin with no obvious lesions. These are all observations that the student must assess. Lastly, facial features. The student is making observations related to symmetry with movement. So you want to look at one side of their face is similar to the other. Moving into the next category of general survey, we're looking at body structure. In body structure, we're observing stature, nutrition, symmetry, posture, position, and body and build in regards to contour. So for stature, we're observing the patient to be within normal height range for their generic heritage. For nutrition, the patient appears to have a weight within normal range for their body build, and even distribution of body fat. For symmetry, we're looking at symmetry within body parts equally bilateral and relative proportions to each other. We don't want one arm longer than the other and one leg longer than the other. And for posture, we're just making sure they're standing comfortably and erect, chest up, and their head facing forward. For position, they're sitting comfortably in a chair or in a bed, arms relaxed at the sides and head facing forward. And lastly, for body build and contour, we want normal proportions for arm span lengths equal to each other and normal muscle mass. Moving into the third category of general survey, we're taking a look at mobility. So in mobility, we're making observations that relate to gait and range of motion. So for gait, we're observing whether the patient's base width is equal to their shoulder width, and whether they have a smooth, well-balanced walk. So each arm is symmetrical once it's swung. For range of motion, we're looking for full mobility in each joint, accurate, smooth, and coordinated movement. Looking at the fourth and final category of general survey, we're taking a look at behavior. In behavior, we're observing facial expression, mood and affect, speech, dress, and personal hygiene. For facial expression, we're observing whether the patient is having a hard time maintaining eye contact with the examiner. Like in this case, if I was talking to a patient, I would be observing their eye contact and their head movement. And moving down, we're observing mood and affect. So comfortable and cooperative with the examiner, whether they're cooperating with me or giving me a hard time. With speech, whether their speech is clear and understandable. For dress, observing their clothing appropriate for climate, looks clean, it fits the body. We don't want anything that's too baggy or too tight. And lastly, personal hygiene. So their appearance, clean and groomed, appropriate for their age. Moving on into the second portion of the OSCE, measurements. So the student measures the patient's weight using a standardized balance or electronic standing scale. The student states one possible cause of unexpected weight gain or weight loss. The student measures the patient's height using a wall-mounted device or the measuring pole on the balance scale. And finally, the student calculates the patient's body mass index, BMI, with all of the previous measurements. So in this case, I do not have a patient to practice this on, so I went ahead and practiced it on myself. So through the mentioned measurements, I got a calculated BMI of 20.1 for myself, and I found this out by calculating weight in kilograms divided by height in meters squared. And lastly, the normal range for an adult's BMI is 18.5 to 24.9. An adult that would be considered overweight would have a BMI of 25 to 29.9, and an adult that's considered obese would have an BMI of 30 and above. Moving on in measurements, the student measures the patient's waist circumference and hip circumference, and with these circumferences, the student calculates the patient's hip to waist ratio. So again, I don't have a patient to practice on, so I went ahead and practiced it on myself. So by calculating, by taking my waist and hip circumference, I calculated my waist to hip ratio to be 0.8, and the normal waist to hip ratio for men is 0.9 or less. Moving on to the third and final portion of the OSCE, neurovitals. The student assesses and reports on documents on neurological record the patient's neurovitals, including all of the following. So the first neurological assessment that will be completed on a given patient would be the Geico-Coma scale. In this scale, we are assessing for eye-opening response, best verbal response, and best motor response. And just want to go through each one of those. For eye-opening response, we would grade them to be spontaneous, to avoid to pain, or none. For best verbal response, we'd grade them to be oriented, confused, inappropriate words, incomprehensible sounds, and none. And lastly, for best motor response, we would rate them to be obeys commands, localizes pain, withdraws, flexion, extension, and lastly none. Moving on to assessment of pupils, we want to see baseline pupil size, so without any light stimulus, we just want to see their normal pupil size. And moving on, so equality between left and right pupils. Here we're just comparing their right and left side being the pupils. We just want to see if they match. And lastly, reaction to light. We want to see how their pupils react to light, if they dilate, if they constrict within normal limits. Moving on into the last part of the neurovitals portion of the OSCE, the student assesses limb movement and muscle strength. The student grades the muscle strength of the patient, and a patient who obeys commands assesses the patient's ability to move both limbs against gravity and resistance in response to a command, and assesses and documents each limb separately and observes for a difference in strength between left and right side. So we're checking for symmetry here again. So scale for muscle strength is graded from 0 to 5, 0 being no movement is observed, and 5 being limb moves against full resistance.